Cluster headache is characterized by frequently recurring, localized, short-lasting but severe headache usually accompanied by ipsilateral autonomic symptoms. It is a disorder producing severe unilateral pain, localized in or around the eye. It is the most common trigeminal autonomic cephalalgia. They're called cluster headaches because they come in clusters of attacks and then disappear for a while. The extremely painful nature of the headache causes patients very great distress and has earned the name suicide headache. It is described as one of the most painful conditions known to man. There are two types of cluster headache, and these are episodic cluster headache and chronic cluster headache. Episodic cluster headache occurs in 85 to 90% of cases. A person may experience 1 to 3 attacks per day up to 8, and they usually occur daily for 2 to 3 months at a time. They usually last 2 weeks to 3 months, and most often occur every 1 to 2 years. Chronic cluster headache occurs in 10 to 15% of cases, and here the attacks occur for 1 year or longer without remission, or with remission periods lasting less than 3 months. The peak age of onset of cluster headache is 20 to 40 years. Men are more frequently affected than women, with a ratio of about 3 to 1, but over time more women are being diagnosed, leading to an observed decrease in this ratio. Head injury, cigarette smoking, and alcohol use are all risk factors. There may be a higher risk for family members, with first-degree relatives having a 5 to 18 times increased risk and second-degree relatives a 1 to 3 times higher risk compared with the general population. However, the exact inheritance and genetics of the disorder are not yet known. Triggers of cluster headache attacks include alcohol consumption. Alcohol is a potent precipitant of attacks. Histamine, nitroglycerin, heat, exercise, smell of volatile substances such as petrol, paint, perfume, or nail varnish, and disruption to sleep patterns, for example, by shift work, jet lag, etc., can also exacerbate or trigger cluster headaches. The exact pathophysiology of cluster headache is complex and not fully understood, and may be due to a combination of neurovascular, genetic, and environmental factors such as alcohol, smoking, exposure to volatile substances. Symptoms are all typically unilateral, with a red, swollen and watery eye, pupil constriction which is called miosis, eyelid drooping which is called ptosis, runny nose, and there could be facial sweating on one side. The diagnosis is made from the history. The International Headache Society, IHS, guidelines have suggested the following diagnostic criteria. At least 5 attacks fulfilling the criteria below: severe or very severe, unilateral orbital, supraorbital, and or temporal pain lasting 15 to 180 minutes if untreated, headache accompanied by at least one of ipsilateral conjunctival injection and or lacrimation, ipsilateral nasal congestion and or rhinorrhea, ipsilateral eyelid edema, ipsilateral forehead and facial sweating, ipsilateral miosis and or ptosis, a sense of restlessness or agitation, typically walk up and down, clutch affected side. Attacks occur from 1 every other day to 8 times daily, not attributable to another disorder. For the treatment options of cluster headache, there's the acute management, which aims to improve the symptoms of the cluster headache at the time, and this can be with triptans, for example sumatriptan, which is injected subcutaneously or given intranasally at the start of the headache. Another option is high-flow 100% oxygen, which is breathed for 15 to 20 minutes to try and improve the symptoms of the headache. Patients are often given oxygen to keep at home to use during the headaches to help with the symptoms. For prophylaxis, verapamil is the first-line choice used to prevent the cluster headaches from occurring. Other medications for prophylaxis such as lithium, oral steroids, topiramate have been tried, with varying degrees of success. Thanks for watching. I hope you found this video helpful. If you did, please like this video, leave a comment and subscribe for more informative videos on medical topics.